Pregnant women, come closer. And if you're not already pregnant, please start looking forward to it. Start working on getting pregnant because the federal government, Tinubu, has a very good plan for pregnant women in Nigeria. The federal government has said about 1.7 million pregnant women dwelling in 15 selected rural communities across the country would have access to free transportation system in 2025. The National Program Manager of the National Emergency Medical Ambulance System, Dr. Shaudu Ahmed Dombowa, stated this in Damaturu at stakeholders' engagement ahead of a project kickoff in Yobe State. Presented by Ahmed Lawan Tijani, Dombawa explained that the agency would provide rural emergency and maternity transportation services for 1.7 million pregnant women by the end of December 2025. Dombowa noted the importance of state governments to key into the program, which would improve maternity health while reducing infant death rates across the country. The state government already has Yobe State Emergency Medical and Ambulance Services. So now we are looking at how we will collaborate to avert the delays in providing health emergencies to improve the indices of the state. The target is that by the end of December 2025, we will be able to reach 1.7 million pregnant women in rural dwellers in 15 states of the Federation, he said. NEMSA's boss further disclosed that to ensure the success of the exercise, there would be a partnership with the National Union of Road Transport Workers, NUTRW, and the Federal Road Safety Corps, FRSC. He reinstated that the target of the government is to improve the maternal health of pregnant women and minimize infant deaths. Speaking, the Yobe State Commissioner for Health, Dr. Mohammed Lawal Ghana, commended the federal government for the program. He said the exercise would complement Governor Mai Mala Boni's quest to provide universal health care coverage in the states. With the coming of this project, it is going to further complement what the Yobe State government is doing in providing health emergencies. We have a lot of gaps, so we believe with this initiative, it's going to minimize it. Nigerian Tribune quoted Ghana. You all, what are your thoughts? Let's have them in the comment section below. I would love to leave my 2 cents before I go, which is that I feel instead of just, providing an emergency service for just pregnant women, why don't you provide an emergency service for everyone in general? And this is not to say that pregnant women are not very important. Of course, they are important. And, this is also for a very good cause. But I feel like if you have, an emergency system or unit for everyone, irrespective of the fact that you're pregnant, you're not pregnant, you're male, you're female, anybody you are, anybody whatsoever, people can easily have access to health care. When people are having health emergencies, there are phone numbers to call, just like you have in US, the 911 phone number that people call when they have any kind of emergency, whether health or security emergency, you name it. There's a phone number to call. There's hope for you when you have such emergencies, unlike in Nigeria, where if you have that kind of emergency, to the extent that even pregnant women say the husband would need, is in a situation where the husband do not have a car, they will need to go and wake up their neighbor in the middle of the night when the woman has gone into labor, to help transport the pregnant woman to the hospital. Anyway, this is a welcome idea. I just think that, It should reach a lot more people, not just pregnant women. You all, let me have your thoughts in the comment section. What do you all think about this? Before I go, let's take a look at some of the reactions we got from Nigerians. Jay's success says this government no go keep person with laugh. How on earth this you arrive at that figure in those 15 rural areas? Kingsley Maduka says, Oga, please bring fuel down and let people live life, be free. Let people live freely. You all, thank you very much for always listening and watching. I will see you in my next video. Bye for now.